CNN Chief Medical Correspondent Dr. Sanjay Gupta and Dr. Michael Osterholm, Director for the Center for Infectious Disease Research and Policy at the University of Minnesota. Great to have both of you. Okay, Sanjay, tell us what you've just learned about the briefings.
Well, we've learned that they're probably best called briefings, not coronavirus task force briefings, because it's not clear that anyone from the task force, at least not the scientists or the doctors, are going to be there. As of this morning, they haven't even been told. So not only do we not know if they're going to be there, they don't know if they're going to be there or not as well. So this gives you a little bit of an idea into how the White House is handling this. It's not going to be just coronavirus that's going to be discussed. And frankly, the people that we should really be hearing from on this, that will give us the idea of what's happening in the country, and also, I think more importantly, the best path forward, it's not clear at all that they're going to be there. They don't know yet. So it doesn't sound like they will be, but it could still change throughout the day.
Michael Osterholm, first of all, let me just tell you that in my household, your podcast is every day listening. My wife is a big fan. I learned a ton listening to it yesterday. Sanjay, I learn from you every morning. That goes without saying. Hi, Allison. Michael, the question is, what do you need to hear from the briefing? What would you need to hear from administration experts if you had a choice?
Well, we don't have enough time today in this show to get into all of the issues I'd like to hear, but let me just hit a couple. Number one is the school reopening issue is going to not just be about kids right now, which it surely is focused on, but it's going to, I think, ultimately be one of those moments where when we look back 10, 20, 30 years about how we handled the entire pandemic, we will look back to this moment. How did we handle the situation with our kids? And I think the most important thing we can do right now is please provide the support to local schools to do what they need to do and let them do that. I have talked to many school superintendents, many teachers, many parents, and they know best. They want to get back in the classroom more than anybody. No, it doesn't take a decree to make that happen, but we have to do it wisely, we have to do it safely. So to me, I would love to hear the top-down message saying we're going to support our schools and we're going to do it the right way or the best way.
Sanjay, we had a really interesting interview with the head of the Teachers Association in Florida, Frederick Ingram, who just gave us this startling statistic about how many kids in Florida, and obviously we could stretch this out across the country, have tested positive. And so that's all you need to know. They're testing positive. I mean, there's tens of thousands. If you look at it across the country, I'm sure it's hundreds of thousands. So they may not be symptomatic, but they're testing positive. And as we know from the latest research, they can also be huge spreaders. So it's really tough when you hear that next month they're supposed to be back in the classroom.
Yeah, I think it causes a lot of anxiety. I've talked to a lot of administrators around the country, and I do think it does come down to one of the things that you guys have talked about this morning as well. I mean, besides the obvious things within schools that you can do or try to do, if you have space, have people, the students and the faculty try and maintain that physical distancing, wearing masks, hand hygiene stations. If there was some sort of testing protocol, that would probably be helpful. But the big thing, as I think everyone has mentioned, is just what is the virus doing in the community in which you live right now. If it's increasing, there's an increased community spread, it's probably not a good time to be opening schools. I think the data on whether or not kids can transmit, and I'm curious what Dr. Osterholm thinks about this as well, but I think it's still a little unclear. I mean, I saw the contact tracing data out of South Korea, and they suggest that 10 to 19-year-olds can transmit just as much as adults. But for younger kids who have largely been at home since March, I haven't seen great studies on exactly what the transmission likelihood is from younger kids as well. I'm concerned that it could also be higher than we realize. We just don't know. But I do think the idea that you want the virus at least going in the right direction in your community so that schools don't suddenly cause a significant flare-up, I think is important.
Professor Osterholm, what do you think of that?
Oh, I think Sanjay nailed it. I think it's exactly right where we're at. We still have lots of questions left. And I want to remind everyone that today, if you look at the teachers in our schools, people who really want to be there, they miss their students something fierce. But yet, if you look at the fact that about 60% of them are over the age 40, and over a fourth of them have underlying health problems that could predispose them to a serious case of COVID infection. And so we also have to be mindful that, they too are a consideration in how we're going to do this safely. safely. Finally, there are many families in this country who are living in multi-generational apartments. They don't have the luxury of spacing out if they need be. So we also have to understand the transmission in children if they bring it back home. So this is not a reason not to have school. It's not a reason to say that it's too difficult. But these are all issues we really must address. And just to give a top-down edict to say you shall, I think is a big mistake. And we have to answer these questions as we move forward.
Sanjay, I want to get your take on another bit of news this morning. Hidalgo County, a judge there in Texas, a judge has just ordered a stay-at-home order, issued a stay-at-home order for Hidalgo County after 34 people died there in just 24 hours. 34 people in just that county. And so, you know, I was talking to Dr. Peter Hotez about this, but out on the street, what you hear, and maybe this is just rosy optimism from people needing to hang on to something, but it's therapeutics are getting better, right? People are using steroids. Not as many, we're bringing deaths down. Not as many people are dying now as were in March. But then you hear something like that. Why couldn't they be saved? Why aren't they getting remdesivir? Or is it too late? I mean, how are we to process huge death spikes like that?
Well, I mean, the huge death spikes are clearly related to the fact that there's more virus spreading. I mean, this has been the same pattern since the beginning. You get more infections, you can have a predictable lag time before you have more hospitalizations, and then more deaths. I think we have made some progress clinically, from a clinical standpoint, in terms of understanding how better to care for patients. You know, the ventilators maybe weren't as effective as we hoped they would be. There are certain medications. Remdesivir is something that can shorten the course that someone's ill. It's not still entirely clear that it reduces mortality. You can use steroids in people who are hospitalized and people who are on the breathing machine as well. But the thing is that these are not panaceas, though, still. If there's a lot of virus out there, a lot of people are getting hospitalized, you are going to have a predictable rise in deaths. And what's happening in Hidalgo, I mean, as Peter described, as a humanitarian disaster, in part he's saying that because this is a community that was sort of disenfranchised already. They didn't have a lot of these resources. And it's tough to get a precious commodity like remdesivir to all the places that need it. There's simply not enough. Again, I'm not saying that that's going to be the answer, but even to the extent that it can help, there's not enough to give it to all the people who need it.
Professor Osterholm, it's interesting because I know we talk a lot about Texas, Hidalgo County, we talk a lot about Florida, California, but I think one of the points you like to make is that it's not just in these more flame-like areas, as the president likes to put it, it's everywhere. The virus is still everywhere, and we need to acknowledge that.
Well, as we've talked many times on this very program, you know, right now we're probably somewhere between 7 to 9% of the U.S. population has been infected with this virus to date. This virus is not going to slow down its transmission until at least 50 to 70% of us have been infected and develop what we call that herd immunity. And that, of course, assumes that we're going to have long-term protection for once we've had the infection. So if you look at this right now, if we had 65,000 cases a day for the next 365 days, that would get us to about 50% of the U.S. population infected. So it gives you a sense of how much more wood this corona forest fire has to burn out there in terms of humans. And so this is why it's so important to get the message out. We're still at the beginning of this pandemic. That's what I find so difficult. Most people are already done with it. They're over. They've decided they are not going to do anymore. Well, they don't get to choose. The virus chooses. And this is what we have to keep getting the message across, is we have to deal with this issue, as we will be for the next year.